Welcome to the Neuroscience of Stress and Trauma. I'm Paige Clemmie, a doctoral student at the Indiana University School of Social Work, and I will be your presenter. This presentation is part of a series of presentations on secondary traumatic stress for school personnel. The learning objectives for this presentation are describing toxic stress and the stress response, identifying important structures related to the stress response, describing the effects of chronic stress and trauma. Stress is used in varying contexts. However, for the purpose of this presentation, stress will be defined as the non-specific response of the body to any demand made upon it. All that means is your body is constantly reacting to its environment, and stress is simply that reaction. A stressor is anything that produces the stress response. I know these are really broad definitions, but stressors can range from completing a task at work, to experiencing a microaggression in the community, to being exposed to an illness, and the list goes on and on. There are three types of stress. The first type we are going to talk about is positive stress. Positive stress is basically stress we handle daily with no issues. Positive stress includes getting to work on time, running errands, getting the motivation to study for an exam, etc. Stress is actually good for us in moderate amounts. Moderate, manageable amounts of stress have been shown to help our immune system and are beneficial for regulating our emotions and our mental health. Tolerable stress occurs when the stress is larger in magnitude, but we have the resources and supports to manage. These resources and social supports prevent the stressor from being overbearing. Tolerable stress would include things like grief or life changes. Tolerable stress results from larger stressors that are made tolerable because we have the resources and supports to manage the stress. Toxic stress occurs when there is long-term adversity and a lack of resources or supports. For instance, say a person loses a loved one and does not have the necessary supports to manage their daily life, then that could turn into toxic stress. Toxic stress includes chronic stress, trauma, and secondary trauma. So, since we have touched on stress, one may wonder, how does it work? So we are first going to discuss how the acute or short-term stress response is supposed to work. Again, stress in moderation or high stress in the presence of a threat is a good thing and ultimately keeps us safe. When I say stress, think of fight or flight. Essentially, the stress response begins when a threat is detected. Many of us tend to freeze when we first perceive a threat. There are a few reasons for that. Many predators sense motion, so by remaining still, we are seeing if we can avoid the threat altogether. Freezing allows our senses to gather more information to see how to proceed. Flight is another reaction. Flight helps us get away from the threat. Fight is the response used if we perceive we can beat the threat or we recognize we would be unable to flee from the threat. So, from the time your body perceives the threat, no matter whether you proceed with freeze, fly, or fight, a few things are going on internally. Your heart rate increases, blood vessels dilate, respiration increases, your body is getting glucose into the bloodstream and essentially making sure you have enough blood, oxygen, and energy to get you to safety. The blood, oxygen, and energy are going to your muscles and vital organs necessary to help you flee or fight. Digestion and the immune system dial down because they aren't essential from escaping from the threat in that moment. Once you get to safety and/or the threat is removed from your body, it shifts back to rest and digest. Here, heart rate and respiration decrease. Digestion increases, and those stress-related hormones in your bloodstream decrease. At least that's how the acute stress response is supposed to work. And for positive and tolerable stress, that is how the stress response works. However, when it comes to toxic stress, there is a constant state of fight or flight. Some symptoms include feeling like you're always on guard, you're hyper aware of your surroundings, or you startle at things that aren't actually threatening. Cognitively, you could be trying to go to sleep and all of a sudden you remember something stressful a student said to you. So essentially it gets to the point where your fight or flight response is perpetually activated, even without a threat present. This can have long-term effects such as difficulty concentrating or remembering, issues with sleep, or not making rational decisions. A system that was designed for short-term survival ends up affecting our body and our mental state long-term. When there is toxic stress that occurs over a period of time, it causes allostatic load. Allostatic load is basically the wear and tear on your body over time. Think about being chronically stressed without being able to relax, recharge, or feel safe. If you look at the beginning, there is the initial stress response. Your body does its thing, reacts appropriately, but maybe you didn't have someone to support you with that stressor. So your set point for homeostasis raises a bit, and this keeps happening over and over. So if you look at the altered set point, it is elevated to where it is higher than the first 4 stress responses. When allostatic load gets to that altered point, we may be seen as overreacting, when in fact our bodies are just trying to keep us safe based on the experiences and environments we've been exposed to. Here is an abbreviated screening tool for teacher stress. While it was designed for teachers, the questions chosen can apply to many roles within the school setting. Take a look. You can stop the video and take the quiz. This slide and the following slide has a total of 12 questions which are rated from 1 to 5, with 1 meaning you strongly disagree with the statement and 5 meaning you strongly agree with the statement. Feel free to pause again and finish up the stress skill. On the left side here are subcategories for the quiz with corresponding questions, and on the right side I have the summary for how to interpret your total score. If you scored 48 plus, you are minimally stressed, at least when it comes to school. 25 to 47 means that you are moderately stressed, and 0 to 24 means that you are very stressed, and there is a good chance that at this time your needs are not being met when it comes to school. When it comes to the stress response, there are a few things going on in your brain that you should be aware of. The alarm center is the amygdala. It is what is gathering information from your senses and determining if there is an imminent threat. If a threat is perceived, it starts off the stress response relay. Again, when I say amygdala, think alarm center. It is a part of the brain that focuses on survival. It's not worried about long-term consequences. Its only concern is the immediate threat. In extreme cases of trauma and neglect can actually affect the physical size of the amygdala. The amygdala sounds the alarm for the relay. This starts the hypothalamus, which tags off to the pituitary gland, which then tags off to the adrenal gland, which releases adrenaline and cortisol. This process is known as the HPA axis for short. This relay prepares the body for fight or flight. Epinephrine and cortisol increase respiration, heart rate, use of glucose, etc. And this is again supposed to be short term. However, with long-term activation of the HPA axis, there are additional structures affected. So here you can see the amygdala, but you can also see the hippocampus and the prefrontal cortex. The hippocampus is important for learning and memory. The prefrontal cortex is the part of the brain that pays attention, thinks through long-term consequences, and is able to plan. When I say hippocampus, think learning and memory. The hippocampus is also where new brain cells are created. Remember cortisol? It's increased through the alarm relay, or the HPA axis. Cortisol in moderation or high cortisol for a short duration is okay. However, cortisol in excess can be referred to as excitotoxic. All that means is too much cortisol inhibits the hippocampus's ability to make new neurons or to learn or to remember. The hippocampus also regularly communicates with the prefrontal cortex. So when there are high levels of cortisol, there is a lack of communication, which can lead to a host of issues such as poor planning, inability to weigh consequences, and in extreme cases, toxic stress can decrease hippocampus size. Here you can see the physical effects of severe neglect on the brain. So one reason for a smaller circumference of the head is, remember about the HPA axis relay we talked about? Well, the hormones that are released actually inhibit growth. Toxic stress affects us long term, but you can see symptoms occur before it gets to chronic disease or mental health issues. You can see on the left side things like asthma, excess weight gain, risky behaviors, hyperactivity. Those are all potentially indicative of toxic stress and things we tend to see earlier on. Toxic stress suppresses the immune system and increases inflammation. On the right side, you see some of the longer-term issues such as heart disease, diabetes, other diseases, increased likelihood of addiction, and mental health issues. These outcomes vary person to person, and things like genetic predispositions and other environmental factors play a part. There are a lot of negative effects of toxic stress, but on the plus side, the brain is incredibly plastic, which just means it's able to adapt. While people have various predispositions, things that have been shown to be effective minimizing toxic stress are support networks, whether it's peer support, family support, faith support, etc. Supports are protective from toxic stress. One reason is oxytocin, the love hormone, actually helps your body get into that rest and digest phase, countering the stress response. So just remember, stress and how we handle stress is influenced by our own experiences, availability of resources and supports, and our genetics. So that brings us to the end of the presentation. Here are some questions to reflect on. Did the results from the stress quiz surprise you? How does toxic stress and trauma exposure affect you physically? How does toxic stress affect others? Thanks for participating today. I hope you learned some things about stress and trauma. If you find that you want to learn more about this topic, you can speak to your school about seeing the Employee Assistance Program or other helpful services that your school provides as part of the benefit package. Supports are needed to manage toxic stress.